As people are living longer, the need for elder care continues to grow. Julie Beaulieu recently interviewed some local seniors who prefer to remain independent as long as possible. She discovered many options designed to keep seniors in their own home environment.
To remain independent is what many elders hope for, whether it be at home or in a retirement community like Loomis's Reed's Landing.
We'd felt that we didn't want to burden our kids with taking care of us, and we looked over at all of the various facilities in the area and even up to Amherst, and kept coming back to Reed's Landing. It felt like home.
He was diagnosed with spinal stenosis, and we had a lot of mowing to do. We had a good-sized lawn, we had a lot of composting, a lot of gardening, and that became more difficult. We didn't want to hire everything, so we thought this is just a new chapter.
Choosing a retirement community for senior living is a great option for those who can afford it. But what about others who wish to remain in their home or apartment but who need a little help? The Sisters of Providence Healthcare Systems is starting new elder care services beginning March 1st. These programs, housed on the old Brightside campus, are designed to keep seniors at home. Various forms of insurance are accepted, including Medicare and Medicaid, says Chief Operating Officer of the Mercy Continuing Care Network, Chris McLaughlin.
On the campus now, we're fortunate enough to have Mercy Life, our PACE program. We also have Mercy Home Care, Mercy Hospice, and our newest ministry, Mercy Companions, which is a private duty provider of support services. They actually may help with dressing, they may help with bathing, other activities of daily living. We've had a few people call and say, you know, I'd like to go visit a friend, I'd like to go to church, I'd like to go shopping, but it's difficult for me to get out. Do you have somebody that could assist me and accompany me with that? And of course we do.
Since most seniors prefer to live in the community, Mercy Life aids to encourage living independent for elders through its interdisciplinary programs. When all services are on the same page and communication is flowing, hospital stays and nursing home visits become less frequent.
What we do is we learn each person's story, and based on what each person needs, we provide what it is they need to stay home and safe.
Mercy Life follows a PACE program model. PACE stands for Program of All-Inclusive Care for the Elderly. Dr. Rachel Brody explains how Mercy Life will work.
Our interdisciplinary team, I think, is the keystone of our program. I think it makes all the difference in the world. I don't think anywhere else in healthcare do you see an entire team from doctor to nurse to rehab, dietitian, home health aide, social worker, all sitting around the table together every day talking about patients. And I think what it brings is an intimacy with our participants so that we really know them, we really understand them.
What makes things easier is having all services under one roof. Mercy Life has an adult day health program, Monday through Friday, with their own transportation system. But in addition, there is also physical therapy and occupational therapy, personal care, hairdressing, laundry, a medical clinic, and quiet rooms, a place where people can lay down and rest when not feeling well, just like being at home, only safer than being home alone.
Usually they come in on our vans. They come in, they might have a continental breakfast or coffee. We have different activities, so we would have something going on as they arrive. So if someone wanted to have a discussion group or to participate in one of our exercise groups or yoga class, all those things are going on through the day. There is a noon meal that we provide, a full hot meal, as well as a pretty substantial snack in the afternoon. But while they're here, they might also go to the clinic for a medical appointment. They might go to the gym, either to work with a therapist formally or informally. We could help them wash up at that point. We could do their laundry if that's what needs to be done.
In the past, these services were addressed by different agencies, and now, with Mercy Life, they are all under one roof. There will even be a chaplain on site for those who would like spiritual services. Both Mercy Life and Mercy Companions start seeing clients on March 1st, but they are taking referrals and inquiries now. This is Julie Beaulieu reporting for Reel to Reel in West Springfield.